Yeah.
Okay, so thank you for coming for the presentation, and so it's basically a conceptual, little bit of a hyper-realistic, futuristic kind of a concept, which is dwelled among, in my brain cells. So it's the medbot. So actually, like it's a humanized or even dehumanized, I don't know. It's a kind of a conceptual, multidisciplinary technology, which is, which can be used in the future as a like diagnostic or even treatment pattern. So it's a mobile kind of technology which I'm proposing. So think yourself as a person who's seeking healthcare. I don't want to use the word patient because no one needs that. What will be your potential challenges in seeking healthcare?
In the future?
No, now.
What is that?
No.
Wait times.
Okay.
Consultations.
Yeah. So traveling basically and coming to the hospital and limited human resources, because healthcare is a highly precise job. You need extra precision to handle human beings and be extra careful. So trained healthcare workers is a limited resource in the society. No wonder, across the globe it's a challenge. So to overcome this, I'm proposing a primary healthcare modality to basically, do the things at home without coming to the hospital. So this is a AI-powered health assistant robot. Actually, it can be defined as a collaborative approached technology. So I'm focusing on improving the patient care and providing the diagnostic support, and also ensures the healthcare monitoring, predictions, and even alarming, referring patients. So my idea and my goal is to revolutionize the current healthcare precision and system, and ensure everyone is getting good healthcare. So in this concept, we are planning to streamline the workflows because there is a workflow step by step. You have to see the GP, either you have to go to the emerge, see a nursing practitioner, or the doctor, then go to the next procedure. So I want to streamline this whole process using AI guided system, and we need to extract the real-time data of the patients to get an ideal outcome. And the robots are basically mobile, so they can go to the home, like they can fly, they can use drones, and they can go everywhere. And the accessibility is high because when it comes to Canada, it's a very big country. I'm from Sri Lanka, and Canada is like 170 times bigger than Sri Lanka. So population is all over scattered. So everyone should get the privilege to have health care. So definitely, if we can give the accessibility, it's the best outcome which we can get. And it's autonomous and it's fast, so the efficiency is high. So still I don't have a clear picture of the bot. So I will show different pictures. So at last we can come to a conclusion. Okay, this is the medbot. So key features in Gen 1, like the initial setup, I'm proposing to monitor the vitals, do some blood drawing, to go to their house and do these things, and do some basic diagnostic tests inside the medbot system, and update the healthcare status. We have Connect Care, We know that in Alberta we have Connect Care. So if you have something like an app like that to upload the real-time data, the physician can like monitor it from the hospital, and the accessibility will reach sky high. And they themselves can refer the patient. Either they are going to a GP, nursing practitioner, doctor, or like emerge. And basic wound care, suturing. I will show you the emerging technologies of this. Physiotherapy, palliative and elderly care, emerge response, which is very crucial, and also AI-driven data analysis, communication, and predictions. So yeah, this is what ChatGPT gave. So the first thing is continuous vital monitoring. So vitals are vitals. Vitals are the basic, parameters in our body, which is ideal to keep our functional body in the ideal and optimal capacities. So it can be blood pressure, can be saturation of the blood, and also heart rate. So these are our vitals. Whenever someone goes to emerge, those are the three basic parameters which doctors, nurses, emergency response teams read. So if the medbot can go to a place, go to a house and read these vitals at a glance, the healthcare provider who's in the remote system or else can be AI, can have a bit of an understanding of the patient without coming into contact. So how does the medbot going to monitor the vitals? Is it going to put a cuff around the arm and do it, or else is there a better technology to do that? So there's emerging technology using radio waves, which has a wide bandwidth. So they can predict the vitals in a contactless situation. So this is a preclinical evaluation is there, but it's not in the clinical level. But still, if the bot is in your house, he can just visualize you and give the vitals without doing a lot of workup. And then the next step is, after monitoring the vitals, then you have to do the blood work, right? So in the image, you can see that you come to the nurse's station, put the cuff, check the temperature, check the heart rate, and then triage and put you to the other station which draws blood. So can a robot or a fully automated system can draw blood? What do you think? Is it possible? Because as a medical student, I struggled a lot, pricking people and I missed it, like that, telling the same story. But so now they have infrared light assisted venous guidance, so they can directly place the needle without any hesitation. I wish I could have that. Too broke to afford it, right? And the other one is like automated system. They can navigate the tip of the needle to a vein really effectively. So we can incorporate this to our medbot in future. So as I mentioned in the beginning, it's a futuristic conceptual idea which has to collaborate and take the ideal outcome. So this is another solution for blood drawing to the medbot. Diagnostic imaging. We know ultrasound scans. We do. Earlier we had a ultrasound machine which is like a big, not a truck actually, but the size of a motor bicycle. But now we have the probe, handheld probe, connect to your phone, and we can do it, right? So ideally we use that in our labs. for research purposes. University of Alberta has designed a handheld ultrasound probe. Um, yeah, so we can mention that. But when it comes to CT, MRI, like big scanners, what do you think? Like, can we make it mobile? Do you know any literature about mobile CT scanners? Yeah.
I think it. I don't know. I don't want to say this wrong, but I think there is an ambulance that has a CT
Great.
scanner.
So in Alberta, we have the mobile CT ambulance. I think like it's like we have Alberta, like Edmonton actually. EMS has the mobile CT scanner, so anyone can go to the doorstep and do the CT. The most important thing about this is like to diagnose the stroke early as possible, because when you come to the hospital, then the management is done. Because stroke has two types. One is ischemic stroke, one is hemorrhagic stroke. Ischemia means like the blood supply is compromised. Hemorrhagic means the bursting of a artery, and as a result, we see blood pooling in the brain and then clotting and then compromise the blood circulation. So we have like two management patterns for these two types of strokes. So for ischemic stroke, we have to give anticoagulants to dissolve the blood clot, but you can't give anticoagulants to hemorrhagic stroke. It can worsen the stroke. So that's the basic idea of having a CT scan to determine whether it's a hemorrhagic stroke or a ischemic stroke, because if we diagnose if it's the hemorrhagic stroke from the CT scan, we can clearly see the hemorrhage. We don't do. So this is crucial. So if our medbot system can have even a little bit more small, like a CT scan machine or even another kind of technology to see whether there's a ischemic or a hemorrhagic stroke, I think that would be great. So you can reduce the time, door to needle time, and that can drastically improve the outcome of the patients. And AI-driven healthcare predictions. We have a lot of apps, tools. Even in my phone, I have cardiovascular risk predictor, which I have a little bit of a high index due to obesity and sedentary lifestyle. Anyway, so we can predict long-term effects, short-term effects, and what will happen next using algorithms. So MedBot can utilize data, real-time data and historical data both, and come to a conclusion, okay, what will be the next step of this patient, whether he will go to a coma, his blood glucose levels are very low, ECG has a bad reading. So like that, the AI-driven robot can have a prediction pattern to notify the world, to the healthcare providers, right? So it can prevent complications, improve the outcomes. So this is a suggested real-time monitoring predictive platform for diseases. So it's clear from ChatGPT. Thanks ChatGPT for making my life easy. And the next one is physio. So the main challenge of some patients seeking healthcare is mobility. So they can't have their ideal mobility due to spinal cord injury or stroke, anything. But the main problem is they have to come to the hospital to get the physiotherapy and all. But mobility is a challenge, and that challenge makes that hindrance. So what if the robot can go to the house and do the walking, help them with the mobility? So we have exoskeletons, right? So in our lab, I'm in rehab medicine, sometimes doing my research. Our main lab is in the Department of Rehabilitation. We have an exoskeleton. So basically it improves the weight bearing capacity, and if there's a lower spinal cord lesion, that helps the patient to regain the mobility. So if our medbot has 2 legs, which can act as a assisted device to walk like an exoskeleton, they can give the ideal mobility training, physiotherapy sessions to the patients going to their doorstep rather than asking the patients to be present at the clinics. And also the medbot, using the algorithms, they can predict the gait of the patient and can customize the training. So currently we have a challenge that our existing exoskeletons, most of them come with the default setting. So it's very challenging for patients because it's not, customized. The other one is monitoring wound care and assisting suturing. So if you underwent a surgery or if you have a diabetic ulcer, the main problem is monitor the wound, whether it's going to the worst or whether it's healing. So these healing prognostic factors can be monitored with a camera simply. So basically we can monitor the dryness, or like whether it's oozing, wet, or like ideally humid, because dry, humid, it's a balance to get the ideal wound care. So we can monitor temperature, the humidity around the thing, and the color. If the wound is red, it's a good prognostic factor, and if it's like has color change, that means that's an alarming sign. So rather than the patient coming every week, every 2-3 days to show the wound, I think the medbot can have this system and give a real-time analysis of the wound, and they can even assist suturing in future. Referrals, actually referral system is the most strong thing in the medical system, because the primary diagnosis and then diverting the patient to the correct facility or the healthcare provider is the crucial thing. So in Canada, what I see is the best thing in Canada is the best referral system, because I come from a third world country. The referral system is chaotic in my country, so sometimes you can lose a lot of alarming signs. But here, the primary care diverts you to the referral, the best referral system. So even you have a cancer, something like it's being taken care of with a multidisciplinary approach. So we can help this team using our medbot, doing the ideal referral, and also helping them to streamline their management plan and also monitoring, right? And elderly care, palliative monitoring. So these kind of things, I think it's very crucial, and even if the bot can have a little bit of a connection with the patient, I think it's ideal. And yeah, so what if it's snowing -40 and you have a big baby bump and fell? It's going to be a big trouble. But think that you have a remote system to monitor your baby's fetal heart rate and even contractions, because some contractions, okay, then the pregnant women can get a contraction and then they get panicked and they rush into the hospital, and actually it's not a contraction. So if a healthcare worker or a doctor can monitor this contraction, and if they can monitor the fetal heart rate without coming to the hospital, that's a very good thing, because there can be up and down of the fetal heart rate. So better to diagnose earlier than getting it complicated, right? So we in the modern world, we have the patch system to monitor the real-time fetal status. So if our bot can do this and notify the hospital or the GP or the physician, then that's well. emergency response capabilities, so that's another challenge. The bot have to have a hybrid system. Basically, he has to fly or go in the road and increase the accessibility of the patients, or else at least they should have the ability to transport organs, blood, emergency medications from the using air. So, as I described, the technology behind my suggestion is basically algorithms, robotics, machine learning, and medical sensors, and a little bit of medical knowledge. So these sensors and everything gathers data, analyze, and it makes our life easy and even the patient's life easy. So my basic vision is to increase the accessibility, reduce complications, reduce waiting times, and utilize our human capabilities to the maximum point. And also, as humans, we know like everyone makes errors. It's a common thing. We have a thing called human error. But in one lecture, I saw that humans working with AI can reduce that, in a significant amount. So I think this will be a good collaborative approach if we can do this. Also, cost effectiveness. You see, manpower is highly time consuming, and as the cost is high, but using AI and all is cost effective. And so we can apply this to real world, starting from hospitals, home care, elderly care facilities, rural clinics, and emergency response teams. And it can be a global solution actually. So we can use this for our future, and overall goal can be established: improving patient care and accessibility, reducing the complications. So do you have any questions? Yes. Thank you.
So, yeah.
No, you go ahead.
Go ahead.
Oh my God, completion for questions. It's not good.
You know, if you had to pick a time when all these things would actually exist, you'd say, well, the 2030s, right? So let's just think about what else is going to happen in the 2030s, according to predictions. So longevity escape velocity, when the longevity increases so much that you're actually sort of getting younger year by year, right? That's supposed to occur in 2032. So this assumes that we have a lot of patients with medical diseases, right? But what happens if that actually isn't the case? Okay, and you may think that's only the only other complication in the 2030s. But predictions for mind uploading is that mind uploading will be very widespread. All it takes is the first person who does it to report how fantastic it is, and a lot of other people are going to want to do that. And then people who have uploaded their consciousness won't need any of this stuff, right?
Yeah.
So what do you foresee occurring? Like, transport yourself to 2032. You think all three of those things are going to occur, or which will actually predominate? Will the MedBot that you've presented to us, that is what you would need if we have as many people with medical conditions as we currently do? If you think about longevity escape velocity, then there'll be a lot of people alive who are just perfectly well. They don't need doctors for anything, right? And then there's also the possibility that a lot of people will upload their consciousness. They can then travel at the speed of light and It's just a much easier life. So what do you think is actually going to happen?
Yeah. So, if there's the concept of longevity and all, I think what happens is like people will have a big amount of time to do another things, like adventurous things, which will open up a big space for emergency medicine because people trying to hike, like go road trips by cycling and all, like can increase the accidents and like if I have a lot of free time, I'll go everywhere and I'll face into like big troubles, so accidents. So I think like making the healthcare more accessible to peripheries will help them to do more adventures. And
So you're saying that if everybody's healthy, we need more of these med bots because they're all going to trip and fall and hurt themselves. Maybe so. I don't know. Yeah.
So my question is, okay, so let's suppose that there's no concept of uploading to the your consciousness to the cloud or anything. Let's just suppose that you add the robot next year or in 2027 with the current state of healthcare. My whole thought process was that this bot is kind of taking over the role of, like you said, the primary kind of contact, right? That first position. So this is maybe ER nurses, right? ER doctors, right? Maybe like that, right?
yeah.
So my whole thought process was right now we're in a position where sometimes something happens and people panic and they don't know who to go to first, right? And so do you think that couldn't this maybe hinder that process instead? Because a person might decide that, instead of going to emergency right away, let me see what this, I'm having, maybe they don't know they're having a heart attack, they go to the bot instead, right?
Yeah.
And the bot says, yeah, you're having a heart attack. But the bot might not be able to use the resources in the room to do a surgery or do that life-saving treatment, right? So what do you think about that, right? Because the bot, even though it has all these brilliant features to diagnose and everything, it can't really do the open heart surgery in your living room, right?
Yeah. So
Security breach.
so I'll address the exact scenario in my point of view, taking two stories in my life and what I encountered as a medical student. So one thing is a person got a heart attack when I was a medical student. He was a world famous cricketer, and then he just asked a medical professional, hey, I have a chest pain, what I'm supposed to do. Then he told you are a sports person, it's more unlikely to get a heart attack, and he went to sleep and it was his last sleep. And so that's one scenario. The second scenario about me, I play a lot of violin, and one day I played for 6-7 hours, and next day I got a chest pain and I went to the ER saying that I have a heart attack. Then actually I had a tooth removal 2-3 days ago. So my stress level, the coagulation patterns and all, due to this bleeding and all, was a little bit changed, and it was the blood work was showing that I had a marginal kind of a blood clot in my lungs, or heart attack, so these are a little bit of misconceptions which you need human human touch and the great decision making capacity. So the medbot will do like this. So if someone is having a chest pain, in medical world it's until proven otherwise, you have to suspect it as a myocardial infarction and do two basic tests. One is the ECG, and then the second is the blood work troponin I to see the cardiac insult. So if the two are negative, then the medbot can say, okay, I reassure you, you don't have a heart attack. Or else, if there's a positive, they can anticipate them seeking the doctor. Go to the physician rather than, taking to Advil and go to sleep. No, don't do it. So that thing we can correct it.
So you're saying it's like monitoring constantly, like anticipates it for
Yeah,
you. You don't
it-
have to have that feeling that, oh, I might be having a, and
Yeah,
then go to it. Okay.
you can have the reassurance
Mm.
and you can have the accessibility rather than driving like 40 minutes to the instead of urban hospital
Right.
and like for the staff, this will help to like monitor the patients from the home and reassure them and have a good sleep.
Okay, gotcha. That makes sense. Thank you.
Thank you.
Okay. Jessica. Yeah.
Have you watched the movie Big Hero 6 before?
No.
Because there's this